Hello, this is Jonathan Rohrbacher. I'm a nurse practitioner student with United States University. This is the abdominal assessment video for MSN 572. This is my patient Stacy. And Stacy, this will be recorded and it will be uploaded on YouTube as an unlisted video for my teacher only to view and grade. Do I have your consent to video you?
Yes.
Okay, great. Alright, I'm just gonna wash my hands here.
Okay.
Hi Stacy, my name is John, and I'm going to be your nurse practitioner performing your abdominal assessment today.
Nice to meet you.
How are you feeling today?
Well, pretty good, other than I've been having a lot of acid reflux.
Acid reflux?
Yeah.
Okay. Is that a new finding for you?
Yeah, I've never had this before.
Okay. Approximately how long, when did this start for you?
I would say maybe about a month ago.
A month ago, okay. What exactly type of feeling are you having with the heartburn? Is it just general burning?
Just general burning. My throat is kind of sore as well.
Okay. Any vomit? Are you vomiting at all?
No.
Okay. Belching? Are you burping?
A little.
Okay.
A little bit more than I normally do.
Okay. All right. So we'll start with asking you some just general questions about your health.
Okay.
With the heartburn, are the symptoms just from in the midline down your throat?
Yeah.
And then you said
it's all up through here.
All up through there.
Yes.
Okay. And you said it's been going on for about a month.
Correct.
Okay. How often do you think that you feel the heartburn throughout the day? Is it every day?
It's not every day.
Okay.
I would say I'm getting it probably about 3 to 4 times a week.
Okay. As far as how severe it feels, if you would say 0 was absolutely no symptoms to 10 being the worst type of heartburn you can imagine, where would you rate it?
It wakes me up, so I would give it probably about a 4 or 5.
Okay. Have you been taking any types of medications for the heartburn?
Just Tums.
Just Tums.
Yeah.
Okay. And how many Tums do you take at a time?
2.
2. And then how often have you been taking them?
About every couple of hours.
Okay.
Usually every 2 hours or so.
Okay. So do the Tums seem to help your heartburn when you take them?
They're really not.
Not really?
No.
But you haven't tried anything else?
No.
Okay. Have you noticed anything that makes your heartburn worse?
Spicy foods.
Spicy foods?
Yes.
Yeah, that can
Alcohol.
happen. Alcohol, for
Yes.
sure. Spicy foods, alcohol, caffeine, any type of acidic food can really make your symptoms worse. Okay. So, as far as medications, are you on any other medications?
I take Zoloft for anxiety
Okay.
and the Tums, that's it.
Okay. Do you know your Zoloft dosage? How many milligrams?
It's 100 milligrams every night.
Every night. Okay. How long have you been on the Zoloft?
About a year now?
Okay.
No, more like 2 years.
1 or 2 years. Okay. Any side effects with it that you have noticed?
No.
Do you think it's helped your anxiety?
Yes.
Okay,
No.
great. Any allergies that you're aware of?
Just seasonal.
Seasonal allergies, nothing, no medications that you're aware of? Any foods?
Nope.
Okay, great. Let's see. Do you drink any alcohol?
Socially.
Just socially?
Yeah.
Okay. Use any tobacco products, cigarettes, any chewing tobacco?
I vape.
You vape. The kind with the nicotine?
Yes.
Okay. I'm not sure exactly how the vaping works, but as far as nicotine, is there a specific nicotine content in the
yes.
vapes?
Yes. It's 5% per pod. And
Okay.
each pod lasts me for approximately a day.
Okay. How long have you been vaping for?
3 years.
3 years. And then before that, did you smoke cigarettes?
Yes.
Okay. Any illicit drug use?
No.
Okay. No marijuana?
Mm-mm.
Are you exposed to any secondhand smoke at home or
My
in the
spouse
workplace?
does smoke.
Okay. In the house? Outside the house?
Outside.
Okay. So you're not exposed to it as much as far as in the
not
house.
the actual smoke, just on his clothing.
Okay. Perfect. Okay. Are you up to date on your vaccinations?
Yes.
Okay. And then have you gotten your flu shot this year?
Yes.
Okay, great. As far as Any medical history? Any past medical problems?
Other than the anxiety and now this,
Mm-hmm.
the only other thing is that I have a horseshoe kidney.
Okay. All right. Any past surgeries?
Just wisdom teeth.
Wisdom teeth. And then do you remember when that was? As far as what year? Maybe how old you were?
2003.
Okay.
I was 13.
Okay. Have you ever been hospitalized for anything?
No.
Okay, very good. Let's see. How about as far as exercise?
I'm moderately active throughout work, so I don't really exercise throughout the day, but I have a very demanding job.
Okay, on your feet a lot?
Yeah.
Gotcha. How about your appetite?
It kind of comes and goes, but I'm eating regularly now.
Okay. How would you describe your diet as far as what you eat? What type of foods you eat?
Pretty well balanced. I really enjoy veggies, and I eat a lot of chicken and fish. Not so much red meat.
Okay. What is your sexual preference?
I am gay.
Okay. Are you currently sexually active?
Yes.
Okay. Use protection?
Yes.
Okay. Very good. Let's see what else. How about as far as any health history with your family? Any significant health problems either on your mom's or your dad's side?
My mother was a type 1 diabetic.
Okay.
And she had significant heart history because of that. And she received a kidney and pancreas transplant.
Okay.
My father has hyperlipidemia, and that's it. My grandfather my father's father had heart disease and kidney disease, and my paternal grandmother had pancreatic cancer. Maternal grandmother died in an MVA. Maternal father, dementia.
Okay. All right. Very good. Let's see here. So from now we will just go over. I'm going to ask you just some general symptoms from basically head to toe, and you can tell me if you've had any history of any health problems or anything that's been bothering you.
Okay.
We'll start out with neuro. Any dizziness, headaches, confusion?
No.
Nothing like that? Any disturbance to light? Any visual problems?
Nope.
Okay, so we'll go now to your eyes. Any difficulty with your eyes? I see you wear glasses.
I do.
Okay. You see you see an optometrist
Yes.
regularly?
Yes.
Okay. Any trouble with hearing?
No.
Okay. Any trouble in your mouth with any sores or lesions, missing teeth?
No.
Swallowing? Any difficulty swallowing? Okay. All right. Any problem with muscles, joint pain, weakness, numbness, tingling?
No.
Okay. Any trouble cardiac-wise?
No.
With your heart? Ever been diagnosed with high blood pressure, low blood pressure?
No.
No heart murmurs or abnormalities? Okay. How about your breathing? Any trouble breathing?
No.
Okay. Let's see. Any trouble urinating? Okay. I know we've discussed the heartburn, but with any other stomach issues, any abdominal problems?
No.
Do you move your bowels regularly?
Yes.
And it's usually formed and soft. Would you say regular?
Yeah, normal consistency.
Okay. I know we talked about neuro as far as your head, but as far as, do you notice any numbness and tingling in your hands or your feet, or cold or heat intolerance? Nothing like that?
Nope.
Okay. No trouble with your feet, no sores, open areas? Okay. Very good. I know you mentioned that you have had some anxiety. Any other psychiatric issues? Any depression?
No.
Okay. What about any endocrine disorders? Have you ever been diagnosed with a thyroid disorder? No diabetes?
No.
Okay.
I've been screened pretty extensively.
Okay. Yeah, with your family history. What about any blood issues? Have you ever had to have a blood transfusion? Been diagnosed with anemia?
No.
Nothing like that. Okay. All right. Very good. And as far as your living situation, are you married?
Yes.
Okay, so you live with your spouse. Do you feel safe at home?
Yes.
Okay, perfect. All right. Okay, so looks like now we will move on to your abdominal assessment. So if I could just have you lay down on the table. Just lay on your back, please. Okay, so first, I'm just going to examine your overall abdomen, look for any abnormalities. Just looking at your skin here, looking at your eyes, your sclera, they're white, there's no signs of jaundice. Your abdomen is flat. Don't currently see any peristalsis. And everything looks normal. So next we'll move to auscultation. So I'll use my stethoscope to listen to your bowel sounds in all four quadrants. Okay, so we'll start with the upper right quadrant. Okay, left upper quadrant. Lower left quadrant. And the lower right quadrant. Okay, and normal bowel sounds, they were normal active in all four quadrants.
Okay.
Okay, so next I'm going to listen to your abdominal aorta, which is right above your belly button. And then I will move and check your renal arteries on both sides and your femoral arteries on both sides.
Okay.
Very good. Everything sounded normal. No abnormalities. Just gonna chart that. Alright. Okay, so now what I'm going to do is percussion. So basically I use my hands and tap on your belly just to hear for any normal or abnormal sounds. Okay?
Okay.
Very good. So there's no areas of dullness, which is good. That's what we want to hear. Now I am going to do the same thing and check for your liver.
Okay.
So first what I'm going to do is I'm actually going to palpate down here.
Okay.
And then your liver is actually kind of stuck up under your rib cage.
Okay.
So I'm going to try to find the border on the bottom of your liver and then move up. Okay, so now I'm going to actually measure the length of your liver. Okay, so it was about about 7 centimeters,
Okay.
which is normal. So now I'm gonna have you put your arm down right here, and I'm actually gonna put my hand under your rib cage,
Okay.
and then I want you to take a big deep breath in, and then relax and let it out. Okay, perfect. So I did feel the base of your liver, and also at the same time checked for the Murphy sign, which would be indicative of a gallbladder issue, and you would have felt some significant pain with that. So since you didn't feel pain, that's a good thing. Okay. I will also percuss your bladder. Okay. And then your spleen over here, which your spleen's also tucked up under your rib cage, so. Okay, I'm gonna do the same thing on this side. I'm just gonna cup my hand under your rib cage. I want you to take a big deep breath in again. Let it out. Perfect. No pain with that?
Nope.
No tenderness? Okay, perfect. Very good. Alright. So next what we'll do is so I'm just gonna palpate, which means I'm just gonna feel around your abdomen. So
Okay.
first we'll start with some light palpation, just light touching, and then I'll do a little bit deeper just to see if there's any abnormalities there. So you let me know at any time if it's you feel any pain or discomfort or anything different. Okay. Any discomfort or pain?
Nope.
Okay, so now I'm just gonna push a little bit deeper. Okay. No discomfort or pain?
No.
Perfect. Okay. Alright, so the next thing we will do is check for any ascites, which you can visibly tell that this patient does have any ascites. Ascites would be any fluid accumulation in your abdomen, but just for the test we could look at both sides. The fluid would accumulate to both sides, which it's not there, but we're going to do the wave test, which I'm going to have you take your hand and put it midline right above your abdomen.
Okay.
I'm actually going to come down this way and just tap. And do it on the other side. Great. Yeah, definitely no ascites with you, so that is good. And then so one additional test we're going to perform is called the McBurney sign, which I am going to find where your hip bone is on this side and your umbilicus, and go about 2/3 of the way down midline, and I'm gonna palpate down pretty deep. Do you feel any pain there?
Nope.
Okay, so that would be indicative of appendicitis. I'm actually gonna do it on the other side just to see if there's any rebound pain. No pain?
Nope.
Perfect. All right. Can I have you sit up?
Sure.
Just swing your legs around this way. So this last thing I'm going to do is check CVA tenderness,
Okay.
and that would have to do with your kidneys. So I'm gonna find the bottom of your rib cage. And then I'm going to tap on my hand, and you just let me know if you feel any pain or discomfort.
Okay.
Okay. On this side.
Nope.
Okay. All right, perfect. All right, well that concludes the abdominal assessment. Do you have any questions for me?
I don't.
Okay, very good. Everything was normal.
Thank you very
Thank
much.
you, Stacy.
Very good to meet you.
You too.